Everybody. Welcome to week 6 pre-class. And in this session, we're going to talk about something that's pertinent to anesthesia and or radiology. So, our topic of discussion is radiation treatment management. And essentially, when you're coding for radiation treatment management, you're coding for your doses of radiation or fractions. In other words, people tend to use the term fraction, treatment, or dose interchangeably. In other words, they're synonymous. So, a patient typically receives one fraction of radiation per day, and then and the reason it's usually one because it allows time for healthy tissues to recover and repair any damage between the treatments. So the total number of fractions a patient will receive will depend on various things such as the type of cancer, the stage, the in general, their overall health and the treatment goals. Now, for some patients, a treatment course may consist of a few fractions, and others may have multiple fractions over several weeks. And today, we're going to learn how to code whether or not you have a few fractions or multiple. And again, I want you to remember that fractions, doses, and treatments are used interchangeably. All right, so let's go ahead and visit the guidelines. Just know that these radiation treatment management codes are reported in units of 5 doses, 5 fractions, 5 treatments. All right, so in multiples of 5. Now, it's when you get to coding more than 5, it gets a little different. I never want to say something is difficult. It's a little different. And here is the language that CPT is telling us. And this is the actual guidance. So code 77427 is also reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of the course treatment. So if you have 7 or 8 or 9, then your guidance is there. So beyond a multiple of 5, you can report 3 or 4 fractions. It must be 3 or 4. Okay? If it's 5, you know you use another code. You already know that because these are reported in units of 5. All right, but if at the course of a treatment you only have 1 or 2 fractions, they are not reported separately. So here are the FTRs. These are the guidelines. This is the clarification of that code. So a minimum of 1 examination is required to code 77427. You just got to know that. You got to have an examination. Also, you have to use 77427 for each 5 treatments. So you use 77427 for every 5 treatments, and use 77427 for the first or final 3 or 4 treatments. What does that mean, Mrs. J? All right, so if you just have 3 treatments, you can use 77427. If you just have 4, same thing. If you have 5, you know you can use it because it does code for 5 treatments. And finally, the final 1 or 2 treatments should not be coded additionally. So you can't code it if you have 6 treatments. You can't code that extra one. You only can code 5. Hopefully that makes sense. And these are your guidelines. These are your FTRs. So go ahead and update them because they are new. All right, I got a scenario. Oh, I got a little ahead of myself. No, I don't. I want to show you the chart, the radiation management and treatment table. It might not be pertinent to what the point I'm trying to make today, but it is pertinent because it lets you know that 77427 is a professional component. You're actually coding for the professional services. 77431, 432, 435 are all coding for professional services. Then when you get down to 77371, you're coding for a technical component. Yeah, you're coding for that equipment. And also look at the top. The first column tells you that the technical component, if the technical component is bundled into the code, and the next column lets you know if the professional component is bundled into the code. All right. So these are good. And also, I like these descriptors here. What does SRS mean? It means stereotactic radiosurgery, IMRT, intensity modulated radiation therapy. TC is for technical component, SBRT, stereotactic body radiation therapy, IGRT, image guided radiation therapy, and PC is for professional component, and that means or is equivalent to modifier 26. All right, now it's time for our scenario, and my keywords are already highlighted to kind of reduce time. Of the following answers, which best describes the encounter? A. 77427. B. 77427 times 4. C. 77427 times 4. 77431. And D. 77427 times 5. A 65-year-old patient diagnosed with lung cancer is scheduled to receive a course of radiation therapy for 22 days, administered by the oncologist. The treatment plan consists of one fraction per day for a total of 22 fractions. After treatment, the patient was re-examined to determine the patient's response to the treatment. All right, I'm going to give you 2 minutes, and your time begins now. All right, I gave you way more time than I should. I want to get right to the business of the code language. All right, so what I did was I shunned my section. So 77427 is radiation treatment management, first 5 treatments, or to clarify it, first 3 to 7 treatments, or final 3 to 7 treatments. I'm going to let that marinate. Now, if we look at 77431, this is radiation therapy management with complete course of therapy consisting of 1 or 2 fractions only. In other words, first 1 or 2 fractions only. All right. So those are the only 2 that I'm going to draw your attention to. But we have 22 fractions, so we have to code for 22. And what we need to do, because 77427, these are coded by 5 treatments, so we're going to divide 22 by 5, right, to find out how many units we'll need to code for. So if we divide 22 by 5, that's going to be 4 units. And that we have, if we have 22 treatments or 22 treatments, we divide it by 4, that's 4 units. The remainder will be 2. So we have 2 additional units to code for. Now wait a minute. First, I want to get rid of some things because we know we can code at least 4, correct? So we're going to get rid of A because A is coding 77427, only 1 unit. And we're also going to get rid of D because it's coding for 5 units. We know we're coding for 4. Now look at B and C. B is only coding for 4 units and it's not considering the 2 remaining. And C, that's coding for the 2 remaining. So let's look closely at 77431. Radiation therapy management with complete course of therapy consisting of 1 or 2 fractions only. That's a clue. You only use this code for 1 or 2 fractions. But if that doesn't resonate with you, look at the parenthetical guideline. It says 773431 is not to be used to fill in the last week of a long course of therapy. There you go. We cannot code it because we have 2 days at the end of a long course and we cannot code it. All right. So there's our guideline. The final 1 or 2 treatments should not be coded additionally. So therefore we cannot code C, and and B is our answer. Hopefully that makes sense. I hope it does. Now I want you to remember these guidelines. And if this doesn't make sense to you, on the right, my notations, if you need to write it a different way, feel free. But remember, 77427 is for the first 3 or 7 treatments or the final 3 or 7 treatments. And for 77431 is for the first 1 or 2 treatments only. All right, so if you got that correct, outstanding. But if you learned something, that is priceless. We got another scenario of the following answers. Which best describes the encounter? A, 77427, B, 77427, 77431, C, 77431 times 2, and D, 77427, 77387 with a 26 modifier. A 25-year-old woman who has been diagnosed with glioblastoma multiforme. She arrives for a course of radiation therapy to help control tumor growth and alleviate symptoms. The treatment plan consists of 7 treatments of external beam radiation therapy using intensity modulated radiation therapy technique. CT guidance is performed to accurately map the tumor's location and surrounding healthy tissues. The physician assessed the patient following the treatments, which were uneventful. Of the following answers, which best describes the encounter? All right, your time begins now. All right, time's up. How did you do? Okay, so here are the key words: glioblastoma, multiforme, 7 treatments, IMRT, EBRT, CT guidance, and that assessment. Assessment is required. All right, and I just think I'm going to just follow the guidelines because it tells us that you can use 77427 for each 5 treatments, right? And at the end of the treatment, you can use 77427 for the first or final 3 to 4 treatments. So let's look at what we're coding for. We're coding for 7 treatments, right? So we know we've got 1 unit, but we got more units. And it says the final 1 or 2 treatments should not be coded additionally. And if you can recall, 77431 is the code for 1 or 2 units only, right? So you don't code it ever with anything else, ever. You never code multiple units of it. You only use 1 unit of 77431. And that's going to make C incorrect because it's coding for multiple units of 77431, and that code is very specific. I apologize for not having it on the screen. However, we've just done it. Feel free to go to the playback and look at the code, or just look in your book, right? Okay, now that leaves us with 77427 and 77427 and 77387. So A and D are left, right? So what is the difference? Well, we're supposed to be coding for EBRT and CT guidance. So even if I didn't know already, I would guess that 77387 is coding for CT guidance. And it is 77387. This is guidance or localization of target volume for delivery of radiation treatment. Includes intrafraction tracking when performed. So you know what? Our provider used CT guidance to accurately map the tumor's location and surrounding healthy tissue. So it was utilized. And if you read the parenthetical note, it said don't report this code with technical components, and for placement of interstitial devices for radiation therapy guidance, they tell you where to go. We don't have interstitial devices. Um, implanted, so we're not coding for that. And this code 77387 is an eligible code, and you can see we appended the 26 modifier because the professional is coding for it, right? So if you said D, outstanding. 77427 and 77387 with a 26 modifier. Now, somebody might say, Mrs. J, you are confusing me. I don't know how to use that 77427. I can't count those units. Well, a cheat sheet for you. All right. So remember, 77427 is coded for the first 3 to 7 treatments or the final 3 to 7 treatments. Remember that. Also remember, or just document it in your CPT manual next to the code. And 77431 is used only for the first 1 or 2 treatments. Only. All right, so if I ask you, coders, if a patient only had 1 dose of radiation, what would you code? And you would say 77431. Absolutely, because you're coding for only one, the first one. What if they had 2 doses of radiation? You're going to say the same thing, 77431, because you use this code for the first 1 or 2 treatments. Now, what if the patient had 3 treatments? If the patient has 3 treatments, you would code 77427 because this code is used for the first 3 to 7 treatments or the final 3 to 7 treatments. So, 77427 is coded for 3 treatments. 77427 is coded for 4, 5, 6, all the way up to 7, 1 unit of 77427. Now, what if you had 8 fractions or 8 doses or 8 treatments? Well, you would code it like this. 1 unit of 77427 for the first 5, and for the 3 remaining, look, here's 3. You would code another unit of 77427. So that would be 2 units. What if it was 9? Same thing. And 10, that's obvious because that's 2 units of 5. And this completes our instruction on radiation treatment management. And hopefully you have a better understanding of codes 77427 and 77431. Feel free to screenshot this cheat sheet if it helps you. Outstanding. Until next time, I'm Mrs. J.